What is known at this point about potential interactions between currently used antiretroviral agents and the more promising latency-reversing agents? Will any such interactions limit the pool of potential participants for HIV eradication trials or the clinical applicability of eradication regimens?
Not much is known about potential drug-drug interaction just because there's only really been just 3 latency-reversing agents that have entered into clinical trials. And there's been very little interaction, drug-drug interaction, causing any sort of serious adverse side effects. And where effects have been seen, they've been less than grade 1 toxicities. So for example, with the histone deacetylase inhibitors, the potential side effects have been thrombocytopenia and neutropenia. But those have resolved very quickly in patients. And there's been some other side effects, possibly due to drug-drug interaction, but most likely due just not drug-drug interaction, but just because of the latency-reversing agent on its own causing some GI symptoms, diarrhea, for example. But all of this is resolved, and no one had anything greater than a grade 1 reaction. And specifically, this is with the histone deacetylase inhibitors vorinostat and panobinostat. So far, there's been no drug-drug interactions. But of course, this is a limited pool of latency-reversing agents with antiretroviral therapies. And of course, moving forward, all of this will be tested. And it might be that we have to test, because we feel very strongly that there's probably going to have to be not only just one latency-reversing agent given to patients on antiretroviral therapies, but most likely it's going to have to be combinations of latency-reversing agents with combination antiretroviral therapy. So we're going to have to look for drug-drug interactions, maybe in non-human primates, to do all of this testing. But so far, where there's been clinical trials with a single latency-reversing agent with patients on heart, there has not been anything greater than a grade 1 adverse reaction. And then there is also concern about having patients, their antiretroviral therapy, including a protease inhibitor. But that won't preclude patients, because then what maybe doctors or clinicians might do is just change the antiretroviral therapy to make it more compatible with the addition of a latency-reversing agent. Take out that protease inhibitor, put in another third drug that would be well tolerated and wouldn't cause side effects. So, but all of this will be tested out. We have a lot of information that we've gained. The several histone deacetylase inhibitors that are now in clinical trial for reversing latency. We have a lot of information that have come from oncology, because these drugs have been tested in cancer patients. So we know a lot about the drugs as single agents or even in combination with other chemotherapeutic agents. So, but we will, going forward, all drugs may have to be tested in combination in non-human primates. And of course, all the pharmacokinetics will be done on all these drugs singly and in combination. So, yeah. So I don't think to get to your last part of your question, I don't think that it will limit the number of patients who can participate, because we have so many antiretroviral drugs that they can be switched to accommodate the testing of the latency-reversing agents.